Hello and welcome to Module 4, the last of the modules. This one focuses on academic and career advising, so it has a little bit different tone than the other ones. And the good news is for you, it's the shortest. Yay! So you're on the downhill. Well, what this is going to focus on is on academic and career advising here at Boise State and how to access your academic records and then academic resources for you. So you'll be ready to go when you get into the nursing program and know a lot of what needs to happen in terms of academic and career advising. Once again, there will be a quiz that's been created and that you'll need to take, and like the other ones, it's not going to affect your grade. We're not trying to trick you. We just want to make sure you have the knowledge you need to be successful. So once again, it's to reinforce your learning and understanding, and you can take as many times as you want. You do need to get 100%. Please do not work on it with anyone else. It's your own. Advising. Advising includes two main components. There's the academic advising, and that's when you think about, okay, what class do I take to graduate? And then career advising, which are choices in terms of the jobs in your future education. Here at Boise State, we have both. And it's done by a little bit different people. Who does what? Academic advising is the responsibility of the peer advisors and also the College of Health Science advisors. And we call them professional advisors. They're located over in the Health Science building across campus. They are available. You can set up meetings online with them or through the online and then meet with them over there. Career advising is provided mainly by your faculty mentor advisors, and you hopefully have gotten information about who yours is, or you will be shortly, and you'll find out that person at least by orientation, usually before the first classes. You'll give notice. So about academic advising, that is the what do I need to graduate. Over the last 10 plus years, the university has in what's called core classes, and that means there's a variety of things like arts and sciences and humanities core that you need to take in order to graduate. This year the core is changing for foundation, so if you are a person who's been in the Boise State system and kind of progressed and got your core done, or most of them done, this won't affect you, but some of you transfer students and the newer people may be needing to change from the foundations to the core. So if this isn't something by the end you feel comfortable understanding, I'd suggest making an appointment with one of the advisors. One best way to find out what you need to do and how you need to do it is to go to your academic record. All of you have what's called, you see on the web, on Bronco Web, academic record, and you hear people talk about the academic advising record, and it is a document that shows what you've done and what you need to do. There is a video that shows you exactly how to access it. If you go into registration, like you're going to register for a class, there's just a different button you push, and then you can see where you're at in terms of the program. As you read the report, you'll find out things like if you need the core or need foundations, and you also can see what kind of classes that you'll need to take over the 4 semesters. It doesn't show you exactly within your AAR what you take per semester, but what you need by the end. In that student handbook of yours, there is a document that shows what classes you take per semester. And every semester, too, you will be getting advising, usually about midway or last third of the program, about what to schedule yourself in terms of general nursing classes for the next semester. If you have core or foundations classes to take, those will not be addressed in that, but the general, you need to take nursing research, you need to take nursing community health, those kind of things will be told to you. If there's any prerequisites that need to be taken, you also can find that information from your AAR. Some people will need what's called an academic adjustment. This is particularly true of people who may have transferred. You might have taken a class that was similar to one that is required, but not exactly. And so a form can be completed in many cases to get that corrected. If you think you need to have one done, the best person to talk is Denise Fiddleston. She is in the 4th floor administrative office area, or you can talk to the College of Health Science advisors about your needs. I just caution people, some people go, oh yeah, you need an academic adjustment, don't worry about it. Don't wait, if you are in moving along and you're like semester 6 or semester 7, and you don't see that your courses have cleared, that everything's showing up, follow up on that, because sometimes people say, oh yeah, it just needs to get done, and it doesn't get done without follow-up. So keep an eye. I recommend every semester you should be looking at that and seeing what's showing up, what's changed, are you on the right track. It's a good way to make sure it's all good. And here, reviewing your AAR, this is the video that you can watch that will tell you exactly how to get to that document, so you know where you are. Can hit the PDF button. It'll make a really nice looking document in PDF format, and it prints right out, and you can keep it for you. Like I said, make sure you access those records now, and I would say every semester take a look at them to make sure things look good, particularly the transfer students. So what you want to do, make sure all those credits that you signed up for showed up, that they showed up in the right grade. If someone didn't accidentally put the wrong grade in or put something that shouldn't have been there. Find out what you need to still take to graduate, and see if any academic adjustments that were done have shown up. Sometimes it takes weeks to get them to show up. For you fourth semester students, or to be fourth semester students, these are the courses you need to be taking. If you are a transfer student or coming into the program for the first time, Intro to Professional Nursing, Health Assessment Lab, Dosage Calculation, Foundations of Nursing, Foundations of Lab, and Pathophysiology. Now I know some of you may have already had Pathophys, so you may not do that. There has been this little rumor around that you don't have to take Pathophys during the fourth semester, that you can put that off. This is not true. You need to have Pathophys in the fourth semester if it is not done already. If you have any questions, you should talk to an academic advisor or a faculty member about what's going on with that, but it needs to be done by the end of the fourth semester. So some people have been told, oh, you can take it in the summer or over the break or something like that. It is a co-requisite for some of the other courses, so don't put it off. If you are an LPN student coming in, your kind of setup of classes may look a little bit different, but pretty close. And make sure you talk to an advisor. So resources. If you are unsure what to take a look at that grid in the Nursing Student Handbook. You can also read our university catalog, which has specific information on what classes are needed for graduation. The peer advisors or one of the College of Health Science advisors are all available to help you with this. In terms of progression, take a look at that grid. In the student handbook. You can also find it on the Boise State Nursing website, although sometimes it kind of hides a little bit. But just know that you are required for all the nursing classes to have a C or better to begin the next term in terms of progression or next semester. More information about progression and re-entry in the program. Sometimes people have to step out, maybe have a baby, an accident, a family member dies, many different things can happen. Information on how to leave and how to come back effectively is in the student handbook. I recommend that you take a look at that. You can also talk with your faculty member advisor, mentor advisor, and they can help you with that too. So you are responsible to make sure that you're signed up for the right classes, and don't rely on advice from friends. Really, really, really. People can be well-meaning and think that they know what they are talking about, but sometimes they get bad advice. So be careful about taking advice from classmates in terms of what to do in terms of classes. Now moving on to career and other advising. Our faculty members here at Boise State School of Nursing will help you in terms of talking about what are your career choices and education choices. We try to have your faculty advisor mentor person, you'll hear those terms put together, match up with your interest. So people who say that they're interested in one area, we try to get faculty members to be their advisor that might be have similar interests. Talking about the career and also about graduate school. Lots of opportunities for nurse practitioners and other people who get on their masters and beyond. And the faculty advisor, faculty mentor is a great person to talk about. So another thing they can help you with if you're having difficulty in a course and you don't know the strategies and resources available, give them a call, set up a meeting, and have a discussion about what is available to you. Other resources I mentioned once before, we do have a writing center here if you're having writing problems. We do have free classes on study skills, test taking, test anxiety. This tutoring boisestate.edu website is one where you can often find it. If that website's not open, take a look at just doing a search and you can find it. Once again, the faculty mentors are also available to you. Additional advice I'd like to give you: the Boise State faculty, staff, and advisors are here to help you to succeed. That's what we're all about. We want to build relationships with you, and we can't if you don't meet with us. So when you find out who your advisor is, they'll probably send you an email in the first couple of weeks of class saying, hey, let's get together. Set up a time with them. They are excellent people to get to know. They are the people who can give you a job reference. They can help you find jobs on campus, find volunteer work. They can assist you in career choices and finding other resources. But if you don't meet with them, it makes it real hard. So I recommend meeting regularly. Once or twice a semester is wonderful. Just checking in with them, seeing how's it going, ask them what you need to know. There's also many websites on advising information. For Boise State, the Advising and Academic Enhancement website is available to you with, once again, classes and information. Our College of Health Science Advising website is here also. Some resources there. So summary of this module is that there's some really important information about your academic report or academic advisory report. Call both of them. And your faculty mentor or advisors are really helpful in terms of finding career choices in graduate school, things like that. They're great resources in terms of advising, so please make appointments with them and talk with them about that. In terms of quiz, yes, just like the other one, there is a quiz on the advising academic process. We want to make sure you understand this, and this is a way that we can help reinforce that reading. Please take a moment or two to take a look at the notes, the readings, the websites, and these slides, and then go ahead and take the quiz. Once again, you're not allowed to use other students, but you can certainly use your notes and the other information. Thank you very much. Bye now.